the answer to the question, when can I lift my grandchild, does not have one date that fits everyone. The answer depends on more than the number of weeks since surgery. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. Carrying or playing with a grandchild can be one of the activities you've been looking forward to since your knee replacement. It may sound simple. You pick up a child, sit on the floor for a game, or walk across the room with them in your arms. But each of these moments asks your body to solve several problems at once. You need strength, balance, knee bend, confidence, and the ability to respond when the child suddenly leans, wiggles, reaches, or changes direction. By the end of this episode, you'll have a clearer way to decide which parts of caring for or playing with your grandchild are ready now, which can be modified, and which deserve more preparation before you try them. A child is not the same as a bag of groceries, laundry, or a weight at the gym. That's pretty obvious. An object usually stays where you place it. A child may push away from your chest, wrap one leg around you, reach toward a toy, or shift their weight without warning. That movement changes where the combined center of weight sits over your feet. Your hips, trunk, ankles, and knees must adjust quickly, sometimes before you have time to think about it. This is one reason the answer to the question, when can I lift my grandchild, does not have one date that fits everyone. The answer depends on more than the number of weeks since surgery. It depends on the child's size, where the lift begins, how far you plan to carry them, whether you need to turn or use stairs, and how your strength and balance are functioning on that particular day. Think about lifting from an elevated surface like a firm chair first. The child is already elevated. You don't have to lower your body close to the floor, create as much force through your legs, or manage a deep knee bend in one or both of your knees. Lifting from a bed may also be easier when the bed is stable and at a useful height. Lifting from the floor is a different task. You must first get low enough to reach the child, organize your feet and trunk, lift both your body and the child, and then regain upright balance. Sounds difficult, but it's possible. You've done it before, right? That difference is important because a person can be walking fairly well and still lack the strength or control needed for a loaded rise from a low position. Research after total knee replacement shows that physical function improves over time, but the course varies widely, and some demanding activities remain limited even when the pain has improved. A calendar can describe how long it's been since surgery, but it can't test the exact task you're about to perform. And this podcast cannot tell you what to do. It's for educational purposes only. An easier first step may be to let the child come to you. Sit in a firm chair with armrests and invite the child to climb onto your lap. This allows you to hold them, read together, or enjoy that closeness without combining the movement with a difficult lift. Early on, sitting to hold a baby or toddler may be a much better choice than standing and carrying them. You can also change the starting height. An older toddler may be able to stand on a stable, non-rolling step or platform while another adult supervises. From that raised position, you may be able to bring the child close without reaching toward the floor. The surface must be secure. The child must be able to follow directions, and you shouldn't use a setup that creates a new fall risk. Be careful about that. The goal is not to prove that you can lift from the lowest possible position. At least I don't think that's the goal. The goal is generally to create a controlled beginning. Before lifting, bring your feet into a stable position, get close enough that you're not reaching with your arms out too far straight, and ask the child to face you, and when developmentally appropriate, hold close rather than leaning away. Bring their weight toward your chest before you stand. The farther the load moves from your body, or the farther they are away from you, the more demanding it becomes for your trunk and for your legs. As you rise, keep the movement deliberate. Push through both feet as evenly as you can, and use the chair, bed, or another stable support when that support is part of the plan. Once you're standing, pause. This way you can kind of get your bearings. Don't immediately turn and walk. That pause gives you a moment to confirm that your feet are planted, your knee feels steady, and that the child is settled into your arms. turning deserves a little special attention. A common mistake might be planting the feet and twisting your trunk while holding the child. Instead, turn by taking some smaller steps. Let your feet change direction with your body, and this reduces the demand of rotating over a planted leg and gives you more chances to correct your balance. Many adults naturally carry a child on one hip. That's what I do. That position frees one arm, but it also creates an uneven load. Research on one-sided carrying shows that asymmetric loads can alter posture and walking mechanics. And that exact response depends on the size of the load, how the load is held, and the person carrying it. After knee replacement, that uneven position may also encourage you to lean your trunk or rely more heavily on one leg. Holding the child in front of you and close to your body may feel more balanced for a short carry, although it can limit your view of the floor. Carrying on one hip may be reasonable for some people once strength and balance are ready. But it should not become an endurance test. Switching sides can reduce prolonged one-sided loading when it's comfortable and safe. But you may want to avoid moving the child from one hip to the other while walking. Maybe stop and stabilize yourself and then reposition, making sure that you're in control of the movement. Your walking path also changes things. A clear level hallway is very different from a hallway with toys scattered across the floor, a pet moving around your feet, a threshold, wet grass, or a crowded room. Before picking up the child, clear the route. Decide where you're going to go and where you'll put the child down. A short planned carry is safer than standing with your child in your arms when you decide what to do next. Footwear is part of a safe setup. Shoes or secure slippers with good traction are generally more reliable than loose slides, socks on a smooth floor, or bare feet on a surface where you don't feel stable. Good lighting helps you to see toys, cords, and changes in floor height. These details can seem pretty basic, but carrying a child removes some of your ability to catch yourself or grab a support. Stairs raise the difficulty again. Carrying a child may block your view of the steps, shift your center of weight, and prevent you from using the handrail. So early after surgery or whenever your stairs are not yet automatic, the safer plan is usually to let another adult carry the child. You can walk the stairs separately with the support you normally use. Before considering stairs while holding a child, you should be able to manage the stairs pretty confidently without the child, without having to pull heavily on the railing and without your knee buckling or your balance feeling uncertain. Even then, the child's size and behavior count. A baby held securely against your body is a different challenge from a toddler who suddenly arches backward. This is an area where advice from your physical therapist can be especially useful because they can observe your stair pattern and discuss safety strategies with you. Getting down on the floor to visit with a child brings another set of decisions. Episode 96 focused on getting down on the floor and returning to standing. And those skills become even more important when a child is nearby because many children may crawl under you, grab your clothing, or try to, quote-unquote, help at the exact moment you need some space and you need to concentrate. Start by choosing a place where you'll get down and get up. A supportive floor cushion can make sitting more comfortable, but it should not slide or collapse under you. A firm couch, stable chair with armrests, or heavy piece of furniture may provide support to assist you in the transfer. Try to avoid using a lightweight table, toy bin, or chair that can tip. That's a recipe for losing your balance. Use the floor transfer method that you've already practiced. Do not make your first attempt while also trying to hold a child. Have another adult nearby when possible, especially the first few times. Once you're settled on the floor, bring the child into the activity. When it's time to stand, create space around you. Make sure the child is somewhere safe and complete the transfer without them pulling on you. Kneeling may or may not be part of getting down on the floor. Some people can kneel after knee replacement, while others continue to have discomfort, numbness, pressure, limited bend, or concern about the position. You do not have to kneel to be involved. You can sit with your legs extended, sit on a cushion or a low firm seat, or place the activity on a child-sized play table that keeps you above floor level. A play table can also be useful when getting down is possible, but getting back up, especially repeatedly, is tiring. You might spend 10 minutes on the floor for a puzzle and then move to a table for drawing or blocks or whatever other activity you can do on a table. Connection doesn't depend on staying in the most demanding position for the longest time. You may be able to enjoy yourself for a longer period of time, if you're just on a low surface and not on the floor. Your level of fatigue deserves a little more respect when a child is involved. As your legs tire, you may rise more slowly, rely more on one side, take shorter steps, or have less ability to correct a sudden loss of balance. The child does not become lighter because you're tired. In fact, the load often feels less predictable because your own control is reduced. This is why the best time to try a new carrying task is not at the end of a busy day. Try it when you're rested, the environment is organized, and another adult is available. Begin with a brief hold while seated, then perhaps stand with the child close to you and sit back down. Later, walk a few steps across a clear room. Each stage gives you information without forcing you to combine every challenge all at once. Your knee's response afterward also provides useful information. Some temporary stiffness or muscle fatigue may occur when you add a new task. A noticeable increase in swelling, pain, limping, or stiffness that persists into the next day suggests that the dose may have been too high for your current capacity. And that doesn't automatically mean that you've caused damage. It does mean that the next attempt may need less weight, fewer repetitions, a shorter carry, or more support. Pain that is sharp, severe, or accompanied by a fall, a sudden inability to bear weight, new instability, significant swelling, wound concerns, fever, calf pain, chest pain, or shortness of breath deserves prompt medical attention according to the urgency of the symptom. Do not use a purely educational podcast to decide whether a potentially serious change can be ignored. There may also be a point when the child's weight exceeds what you can safely manage right now. And that can be difficult because saying no to lifting a child may feel like saying no to the child overall. They're not the same decision. You can sit and invite the child to come up and sit with you. You can offer a hug at their height. You can play at a table, read together, or ask another adult to place the child beside you on the couch. You can say, "I can hold you while I'm sitting," or "let's climb up together." A clear limit can protect both of you without reducing affection or involvement. For older grandchildren, include them in the plan. Children often respond well to a simple job. They can help clear toys from the walking path, bring the book to a chair, climb into the couch beside you, or wait until you're seated before giving you a big hug. That language can stay positive and direct. You're showing them how to move safely around someone whose body is still rebuilding strength. A great learning opportunity. A stable step stool, firm chair with armrests, supportive floor cushion, or raised play surface may make certain activities easier, but none of these tools replaces the ability to control the task. Any stool should be stable on the actual floor where it will be used, and the child should be supervised. These are examples to compare, not requirements, and the right choice depends on your needs and healthcare guidance. I'd like to invite you to sign up for the free Total Knee Success Insider newsletter for practical education, new podcast episodes, and helpful resources for wherever you are in your knee replacement journey. Click the link in the show notes or go to totalkneesuccess.com. Returning to time with your grandchildren is not one test that you either pass or fail. It's a group of separate skills. Sitting and holding may come first. Getting on the floor may need a transfer strategy. Walking while carrying may require more strength and balance. Stairs may need to wait until your movement is much more automatic. Breaking the activity into parts allows you to participate now while continuing to prepare for what comes next. In episode 99, we'll explore returning to the gym after knee replacement. We'll talk about common questions people have as they begin using gym equipment again, how different types of exercise may fit into the bigger picture of rehabilitation, and some of the practical considerations that can help you make sense of the transition. Thanks for joining me. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share because every step forward takes you closer to living the life you love.